Hello, welcome, guys. Good evening. Please let us know where you're joining from in Nigeria in the chat. You are able to see that on the far right hand. Awesome. So you are here because you showed some interest in health insurance plans in Nigeria, and we are super excited to have you. I think it might be actually the first health insurance webinar in Nigeria that we're running. So this is very exciting news, and we couldn't be happier to have you guys join today. So I will go ahead and started going. So the agenda today for the webinar. We'll do quick intros. We will then talk about the partnership between Andela and AXA Mansard. And then at the our invited guest will do a presentation about the plans. And at the very end, we will actually have quite a bit of time to answer any questions you guys might have. So please make sure to submit your questions throughout the webinar. I'll be closely monitoring them. So you have two ways to do that. You could either type them into the chat that is again on the right side of your screen, or there is a Q&A tab right next to chat as well, so you will be able to do that. Awesome. I see that we have folks joining from Kur. That's great. Wonderful. So today, so my name is Stanislav. I am based out of Brooklyn, New York, and I joined Andela about 6 months ago, and I'm currently in charge of the health insurance program, which is a super fun initiative that Andela is offering to our engineers. Um, and this has been a great experience for me personally. I also have Ayudele joining us today as well. He is the main POC on the AXA side. Ayudele and I, we actually work together very closely. And then today we also joined by Oscar. He is on the back end of the webinar setup, and Oscar is based out of Mexico. He is a marketing team member, and he helps to run this as smoothly as possible. So please give a huge shout out to Oscar for helping us set this up today. Great. So with that, I'm going to hand it over to Ayodele to let him present himself, and then we will start it going. Before we go into this, I actually would like to run a quick poll and just get a pulse on pulse about health insurance in general, and to see if you guys currently have a health insurance plan. So the poll should be up and running now. So please make sure to go ahead and check it out. There are only two options there, yes and no. So that will give us an idea of where you guys currently stand today. If you may be looking to, just maybe curious about what's being offered through AXA Mansard in Nigeria today, not necessarily looking to purchase a plan right away, or maybe you're actively looking, and if that's the case, that's great. This is exactly why we have this webinar. So if you are actively looking, I imagine you have tons of questions that are kind of open and on top of your mind. So make sure to send those over through either the chat or Q&A section, and we will be answering those questions at the very end. Alrighty. So I think let's go ahead and I think we should have had enough time to let people answer the poll. So let's go ahead and close it out for now. All right, perfect. So with that, I'm going to hand it over to Ayudela. Ayudela, tell us a little bit about yourself.
Yeah, good everyone. Thank you. I'm happy to be here and good to have you all. My name is Ayodele Akib, representing AXA Mansard. I'm responsible for retail partnership and public sector management, business management for AXA Mansard Health. And today I'll be telling you how great is it for you to have an AXA Mansard health plan as a member of the Andela community. I'm sure it is going to be awesome. Just stay by when it's my turn to talk. You're going to enjoy it. Thank you. Thank you, Stan.
Awesome. Yeah. So Ayudela, tell us where you're based
Okay.
out of, and how long have you been with AXA Mansard? And maybe tell us why
Oh, oh,
why you like to go to work every day. What excites you about your current
oh, good. Yes. So, I'm based in Lagos. I'm from Nigeria. I'm based right now. I'm talking from Nigeria, Lagos. I'm working for AXA Mansard for 9 years in different roles. So it's been an exciting place to be. So I look up forward to going to work every day because my job is all about solving problems in healthcare business. So make people live their life in a full in an happy way. So make people fulfill, get more by doing by living healthy. So I look forward every day to go to work too because I know every day for me is making life count for people. So that's for me.
Awesome, awesome, great.
Thank
So
you.
tell us a little bit more about AXA Mansard and how it is different from any other insurance companies in the market. How do you guys stand out with comparison to competition?
Okay, thank you. AXA Mansard currently is the leading HMO in Nigeria. Interestingly, we started operations about 9 years ago. So, and within the space of 5 years, we became the largest, the biggest HMO in Nigeria and in West Africa. And uh, for AXA Mansard, we are able to achieve this. We brought in so many values to the customer in terms of speed in response to customers and customer service in terms of innovation. So we brought a lot of innovation to this to the industry to make people be able to solve problem. And most importantly, we have a good relationship with our provider. So AXA Mansard is an entity of AXA in Nigeria. So AXA the globe is a global leader in insurance, operating in over 54 countries, and we deal in health and insurance and investment. So in Nigeria, it's not different. So year to back for 11 years, AXA has been the number one brand globally, and of course, that is not surprising because AXA is providing value for people, for the customer, for all the stakeholder. Same thing we are doing in Nigeria. So as an HMO, you're going to be enjoying a lot of value from AXA Mansard, right from comprehensive care, from the way we deal with our stakeholders, providers, customers. All this make us different. And like I said, this has put us in the forefront and to make us to achieve a feat, being the largest HMO within a space of running for 5 years. Now, I will tell you, if you're interested, to tell you that AXA is bigger than three HMOs together in Nigeria. So because putting everything together, we are bigger than the second and the third HMO together. So and that's excellence for you. Thank you.
Awesome, awesome. This is great. So I'm just looking at the results of the poll we ran, and I see that 75% of respondents said that they currently don't have an insurance plan. So we definitely have a crowd that is interested to learn more. That's great. So and just a reminder, you guys, in the meantime, if you have any questions that are sort of burning on top of your mind, feel free to send them through the chat feature or under the Q&A section. Okay. Awesome. Thank you, Adele. So I just also wanted to ask you about what do you like most about the current partnership between Andela and AXA?
Okay, yeah. So most importantly, is within the time we started this relationship, I have enjoyed the challenge that Andela's brought from. So Andela is actually I can see is a one company that if I have the opportunity, I want to always do the to continue that relationship to again. So because we have challenged us in terms of we realize that you want good for the people in terms of Andela first from when the relationship started. Andela was able to make sure that they negotiate a very good value for the customer. And of course, as an employee, if you are able to have what Andela is bringing to the table in terms of healthcare, there's no more. You have even comprehensive healthcare, which does not have which is does not have a limit. And of course, that's one. So it keeps you motivated. It gives you strength to do more. And again, your people are fantastic. So from the POC that we deal with and the people that already sign on. So of course, within the time we've started, I've find an interesting time dealing with Andela people, courteous people, very detailed, and of course, very
Mhm.
polite people. So this I like about Andela, and I still can do more. Thank you.
Yeah, yeah, that's awesome. Thank you so much, Odeli. You've been a pleasure to work with as well. I just want to say that we also, the health insurance program at Andela, um, we have three main aspects we're working on, right? It's
Okay.
making sure that people get immediate access to healthcare. The
Okay.
premiums that we offer in through our partner are very competitive in that particular market. And those are very important kind of key aspects. And what I personally like about AXA Mansard is that they meet in all the sort of criteria that we are working with, and it's very important, right? Just as a reminder, you guys, the just as a reminder, the program. So we negotiate down the premiums with partner AXA in this case, but you are responsible yourself for paying that premium, right? So we are trying to get the best price possible for you, but ultimately it's up to you to decide if you want to sign up for a plan, and if yes, then you go ahead and pay for your premiums, and then you have a contract with AXA Mansard directly. But Andel does everything we can to present you with the best options available to us and in the market in general. Great. So I'm actually curious to learn a little bit more about the folks today as well. So I would like to run another poll for you guys and find out how many people you're looking to insure. So the options are just yourself and partner, yourself and maybe your kids or other dependents you might have. So let's go ahead and put that up and see what type of crowd we have today. Um, we have community that is like a lot of software engineers, and I feel like recently in terms of the data and what I've seen is that we have sort of a trend towards more of like a family oriented crowd, right? They're not just looking to insure themselves, but also their kids and other dependents. And actually, it seems like it's actually the case today as well. So let's keep it on for just a little bit longer. Um, we're really curious to see. All right. So at first, there was a sort of a tilt towards, the family. But now I'm seeing there is like a 40% individuals and 40% of folks looking to insure
Yeah.
families as well. So that's really interesting, right? So we kind of have sort of diverse crowd there. That's cool. Awesome. Let's go ahead and end the poll. Great. So with that, I'm gonna hand it over to Ayodele. He is gonna give you guys an amazing presentation about the company and the terms and different benefits that are included. Now, this is medical insurance, right? And we all know this is like not the most fun and exciting presentation you could probably get in life, but try to stay with it. Make sure that you understand like different terms that are being used. If you don't, please send your questions in. Again, we will collect all the questions at the very end and we'll answer them in the order received. If you have any specific questions about like certain benefits, this is a great time to go ahead and answer those. Even if you have like any specific conditions or illnesses maybe you're working with and you just want to confirm if that's something that's covered or not, this is again a great time to ask those questions. So make sure to use your time with us today. And Ayudele, I'm handing it over to you.
All right. All right. Thank you so much, Stan. So don't worry. So I understand I'm talking to engineers. I'm going to be using terms that are very understandable. So I'm not going to be using medical terms. And I can see already from the poll that your people are very family oriented people. Yes. Of course, this is a place to be. And we have a bunch of bundle of value for you and, of course, for your family that you care for. So now I'm going to be taking you through AXA Mansard, and this is going to guide my presentation is going to be guided by this outline. So we talk about the AXA, or so we'll talk about okay, pardon me for this. So let me just quickly. So we'll talk about AXA, your AXA Andela AXA plan, show you the pricing, the term and conditions, and the processes that are involved. So now about AXA. Uh, AXA is a global leader in insurance and asset management. So we operate in over 55 countries. And all this you are seeing here is just showing at the pedigree about AXA Mansard. So now, um, as a company, can you still hear me, please? Yes, I'm sure you can hear me. I'm sure you can all hear me. Yes. Okay. So as a company, we have brought some value for you. So you have a plan that that gives you access to care not only in Nigeria, but also give you access to care in India is for cases that cannot be handled effectively here in Nigeria. We have seen situations whereby we have people who need medical intervention and they are not available here, especially in terms of like cancer care. So AXA have been able to make sure that we it's a local plan that you're buying, but we see that because of the sh- the um the default in Nigerian medical system, whereby there are some facilities that are not available because of our medical system. So people seek intervention outside the country. So we have seek an India for everybody, so that you can, if you have need care, and so we're going to take care of the the logistics, but AXA will take care of medical bill as it is covered for you. It's ease of access for everybody. We have a system. We are giving you a care that is giving you ease to the access to your care. You automated our eligibility and authorization process. You go to the hospital, you are not expected to be delayed more than 10 minutes. So that is why we say a 10 minutes no delay campaign is for you to make sure that when you get to the hospital and the hospital is getting authorization process, you're not expected to delay more than 10 minutes. We have a plan that is giving you access to roaming across all our hospitals. AXA Mansard had over 2,000 hospitals across the 36 states of Nigeria, including the Federal Capital Territory. You could walk in and use any hospital as it's convenient for you. So typically what you will see in some HMO will tell you that you have to choose an hospital, and that hospital that you choose is what you should use anytime you need care. But in AXA Mansard case, no. You are open to use any hospital at any time. This is roaming. So as it is convenient for you. You are in Lagos at the moment. Maybe tomorrow you don't know, may find yourself at other part of the state, and you need to access care. Just check through the AXA list, go in there and access care. So at no extra. So that is the value that AXA brought to you. Again, as AXA give you access to second opinion. We have seen cases where people have not been able to diagnose We've not been able to diagnose medical condition properly, maybe because of inadequate experience or technology. So we'll say that especially when it comes to cases that require surgery. So a second opinion have helped people to to get better care and better opinion. So what we do, we refer those patients to a more specialized center for doctor to review them and get better opinion then. Or in some instances, we send medical reports, customer enrolling medical report to our partner, maybe in India, South Africa, or UK. So they will review this and they give us their opinion. This has helped us to help a lot of people to get proper diagnosis on their condition. Another thing is telemedicine. We take an advantage. We also take advantage of the opportunity that the COVID has brought to us. You can see, look at we're having webinar now. We are engaging. I'm where I am, and you are where you are, and we are engaging. You can see me on screen, and I can also see you as you wherever from you. So now the same thing has been brought to medicine. We have telemedicine. AXA Mansard will give you access to a telemedicine where you can consult with over 200 GPs and specialists online. And when you need to get a medication, they just send your medication to the platform, then take your prescription to any of our partner pharmacy around you. We have had partnership with more than 200 pharmacies across the country. So you just go in there and get your medication. What this is telling you that you can even consult your doctor without even going to the hospital. So this is part of the value that AXA Mansard will be giving you. AXA Mansard also give you the pharmacy benefit program. This means that for people with chronic condition like hypertension, diabetes, so instead of you to be going to the hospital every month to get your medication, we are saying that you can go to any of our pharmacy partner to get your drug refill. You don't necessarily need to go to the hospital and queue every month when you need or when your medication is exhausted. Our pharmacy benefits can give you this advantage. So just go to any of our pharmacy partner. MedPlus is one. We have MedPlus in over 36. We have over more than 58 branches of MedPlus across the country. You can use any. So you get there, you get your medication, and AXA Mansard will approve, and that's all. So you only go to the hospital only when it is necessary to go and consult with your doctor. And if you prefer it, it can also be even dispatched to your location, anywhere your preferred location, maybe your office, maybe your house, anywhere you want it. So the medication can also be dispatched to you. But that if you are in Lagos, Abuja, or Port Harcourt. But if you are in other states, you have to just go to the pharmacy partner pharmacy center. So our plan also give you access to health screening. All our plan, your plan that AXA Mansard Andela give you access to have annual medical screening once in a year. So you can go in and have comprehensive check. So this is wellness, and it keeps you be aware and keep you well at all the time. So again, we have some service enabler that also make you uh, enjoy, make the experience be seamless. Number one, we have USSD solution. So what this does for you, maybe at the time you needed information about your membership and enrollment detail, and you don't have it, you can dial this number on your mobile number that you register with AXA Mansard, and you will get your enrollment detail. Maybe I don't have my detail, and I don't have my card, or I don't have what I need it at any time. So just pick up your phone. You can call it on or you can retrieve it through this code on your mobile phone. Again, we have what they call vaccination at home. I can see when Stan was running poll that we are family oriented people, and of course, we have babies who are due for immunization, and for one reason or the other, maybe the mother is not able to take the child to the hospital. Then, so what you do is, uh, you can call us. Those immunizations are scheduled. You already have the card. It shows you this one will be due in 6 weeks, in 1 month, and like that. So you know when the immunizations are due. So just contact us at least maybe a week to the due immunization. When you contact us, we will schedule the vendor to your house. You have an agreement on when the vendor can come to your house, and they will move to your house and vaccinate your child even from your home. This is currently being working in Lagos. Hopefully that in a few months it's going to be extended to other part of the country. But if you're in Lagos, this is available for you. Again, mental health support. We have mental health support. We are one HMO that pay attention to mental health. We have had an agreement, a partnership with the leading EAP provider in Africa called Grey Insight. EAP means Employee Assisted Program. You will need to talk to somebody about your mental health. You are feeling that, or you feel that you may need to be counseled. Maybe you feel depressed, maybe you feel you have some things that you need to just express or to bottle out, and you need to talk to somebody, a psychologist. So this give you the platform to do that. Axamasa as an Axamasa enrollee. So this is embedded in your Andela plan. Just keep a phone, get in touch with the provider, and they will give you attention. And it is confidential service. That's what is interesting part of it. We don't know what you did. So whatever you do with them is confidential between you and the provider. So this is enable you to deliver more, because we believe that when your mental health is stable, you'll be able to be more productive. Again, we have our AXA app. When you are as a member of AXA Mansard, so you can download our app. So do the necessary authentication from the app. You can see all your benefits, all what you need to see about your plan, all the information. Not even only on health. If you have any other AXA Mansard policy, you can see this and you can manage your policy for it. But ultimately, for health, you can see your ID card details. You can see when you are in the hospital how your approval process, when hospital requests for approval. You can see that they have requested for PA, and if it has been approved, you can see. You can make an inquiry. You can call for your drug medication refill for those who need drug refill. All this and lots more you can do with my AXA app. All this we have put together to make sure that it makes your experience being seamless. Now let's briefly go to let's look at your AXA Mansard Andela health plan. Okay, the key highlight here is we are offering you a plan that is very affordable. As low as 10,000 naira, you can start buying a plan from as low as 10,000 naira. When I get to the pricing time, you'll see how this been broken down for you to be very. And again, we've been able to put together a flexible payment mode for you. So we want to make sure that the payment is flexible for you as your pay is dropping on a monthly basis. So you it's also when you will be paying for your health. So and this is one of those things that Andela has negotiated for the talents, and this is interesting. AXA Mansard product is buy and use. Unlike other insurance, you don't need to wait for maybe for 14 days, 21 days, or how many days before you start using the plan. You can buy a plan today. Once you are confirmed that you have been enrolled, and then you can start using it immediately. That is AXA Mansard for you. So no waiting period to access healthcare. So just buy and start using the moment you confirm you have been enrolled on the plan. You have wide access to hospitals. AXA Mansard today has the widest, largest hospital network. We have over 2,000 hospital network, and it's still growing. So now you can use any hospitals around you. There's nowhere you go to every corner you get to that you won't find AXA Mansard and provider. Only in rare occasion you may not have this. So now co-payments, no co-payments on AXA Mansard plan. You are not paying for drugs, or you are not paying for part of the treatment. AXA is paying for whatever is covered for you as benefit, 100%. So you are not part paying or co-paying for medication, for investigation, for consultation. AXA is paying for that. Then there's no overall limit on your plan. There's no annual limit, either for inpatient or outpatient. You will see some HMO that will tell you, because you are paying maybe 120,000 naira per annum, it means that if you have enjoyed care up to 1 million naira in a year, then you have exhausted your limit. This is not so with AXA Mansard. So there's no limit to no annual overall limit on your care, except in some cases of course, benefit that are capped. But in terms of overall limit, no overall limit. Optical and data is also inclusive in your plan. In some plan, they will ask you that before you can have optical and dental, you must have bought it as a rider on your plan. But with AXA Mansard, no, you automatically have actually this is bundled into your plan, even though it has to. When I get to the term and condition, you will see when you begin to access this. So And again, pre-existing and chronic conditions are also covered for you. So there's no waiting period for, I mean, that's pre-existing and chronic condition is covered for you, but according to whatever it is in your payment plan. I'm going to be showing you, or when you go to want to buy the plan, you will see the benefits and how you are stated. Some benefits are granulated, and the reason is it is understandable. By the time I get to that slide, I'm going to explain to more about that about it. But this highlight you are seeing here makes AXA Mansard different, makes it more attractive for you, and make it to add value onto your healthcare system. So now I won't have time to run through this, but I just want to maybe in 30 seconds or I'll give just 5 seconds for every slide. So this is the breakdown of the benefit. But you can see this, you can access this even on Andela page where it is posted, so you can see the detail of what this. But what I just want to say here is that you will be seeing some benefit that say the moment you come in, you will get them immediately. They are covered for you immediately. While some you may have to wait until a particular time. When you see Q4, Q3, it means that Q2 means that you must have spent, okay, 3 months is a quarter. You must have spent 9 months before you can begin to enjoy after 9 months. But subject to your payment plan, anyways, not in all cases. If you buy a plan and that give you access to, you pay 1 month plan, then that means you begin to enjoy your full benefits immediately if you pay full year. But if you decide to stagger your payment or you pay other flexible payment, then you'll be having waiting. Accessibility from a particular period. So you're going to see more of that detail, like I said, when you go into the Andela page and you go and look at your benefits, and it is understandable. Okay, so these are the benefits from antenatal care, from diagnostic services to physiotherapy to obstetric and gynecology services, and in antenatal delivery, whether normal delivery or CS, neonatal care and pediatric services, including immunization for children. This is also covered. So you can see accident and emergencies is covered for everybody on the plan. Dental services is covered for you up to 80,000 naira on the plan. Okay. Ophthalmology services is covered. Okay. Um, Okay, ERT services is covered. So you can see you are covered for eye care, including eye surgery, and you can have eyeglasses up to 25,000 naira once in every 2 years. Then you are covered for surgical services. Surgery is covered for everybody, and so also other services, including comprehensive health screening, as you can see here. So and some other value-added services like travel insurance, like subsidized fitness or nutritional club membership, access to gym, and some other things you can see as you can see them here on the plan. Okay, yeah. Now, generally, there are things that health insurance will not cover regardless of whatever plan you buy. They are just standard exclusion on health insurance. These things you are seeing here are not covered on the plan, from cosmetic surgery, alternative and orthodox treatment, high-tech or sophisticated surgery like laser surgery, like laparoscopic surgery, and the likes. And all these you are seeing that are listed here. But there are standard exclusions in insurance, mostly even anywhere in the world. So, uh, apart from this, every other thing will be covered according to your plan and your payment option you have chosen. Now, how much they cost? You can get as from 40,000 naira, which is even less than $25. That's on a monthly plan for family. So you can get up to 40,000 naira per family on a monthly and 10,000 naira per individual if you choose to pay monthly. But for quarterly, it's going to cost 120,000 naira per family and 30,000 naira per family if you choose to pay monthly. Okay. So for individual, I mean for quarterly for individual. Sorry, pardon me. So for if you decide to pay annually, it's going to cost 240,000 per family and 60,000 per individual. And if you decide to pay once and for all annually, it's going to cost you 480,000 naira for a family and 120,000 naira per individual per annum. So, and this explain more, give you more explanation. Now, maximum age limit on the plot is 60 years. You can so you can sign on as long as you're not up to 60. A family comprises of the staff, that is the principal, your spouse, and up to four dependent children under the age of 25. But non-spouse dependent are not entitled to antenatal. Your spouse, as a man, if you're a man and you have your wife is on the plan, is she's entitled to antenatal according to the plan you have bought. But if you have a child uh that is a child, maybe a daughter, or who is and who is pregnant, is not going to be able to enjoy antenatal care on the plan. Only for the spouse. Yes, customer who pays for the annual premium, you have access to your full benefits. So what we're saying is that despite the fact that the plan are granulated, you can see some benefits, you enjoy them at third quarter, some at second quarter, some at fourth quarter, as the case may be. But if you decide to buy your plan and pay in full for 1 year, that will not be applied. You automatically have access to all the benefits without any limit. You can see that is wonderful. Now, the premium payment plan to be selected. So when you are want to buy the term and condition, so make sure that you, although you have minimum, we have up to 10,000 monthly plan, but we prefer, because of operational purpose, we prefer that you choose minimum of quarterly payment. Okay, so for new members, when you are onboarding, it may take up to 48 hours to all, but it in most cases is less. But we need to say it may take up to 48 hours for you to be on board. But the moment your onboarding process is concluded, you can start accessing care immediately, no waiting period. Member is expected to set up a direct debit when you buy. So make sure that you buy with your card and you set up a direct debit when you are purchasing on our portal. So then your plan will be deactivated if payment is not received within 48 hours after your renewal is due. So we expect that your cash should be funded as you are buying the plan. But if for any reason your card is not funded and it fails, or you did not set up direct debit on the platform, but for one reason or the other, the platform. So we'll give you up to 48 hours to make sure you make the redress. But if after 48 hours you did not, your access to care will be cut off. But we'll have to make sure we contact you and let you know. So the moment you quickly do that, then you can come back and continue to enjoy your time. Where a policy expire and you did not come back within 30 days. Okay. So, which means that you will forfeit all your moratorium. What does this mean? You can see that we have some benefits you should start from, maybe from second quarter, but you pay for only 1 quarter and you did not come back to renew your policy after 30 days. Ordinarily, you should have continued that service from second quarter, but because you failed to renew in 30 days, so you will have forfeited that moratorium. It means that you will come back as a new member. And if you check all this, they are just reasonable. Reason being that some people only pay for these services only when they use it. I have seen somebody who wants to pay, they only pay 10,000 naira because the wife wanted to deliver at the hospital and he never come back. So, that is why we put check into this to say, so that people, so when you are coming to, you are not just coming to game the system. I know Andela people are good people. So, but we see that in other platform. People do that. So that is why we have to make sure we put all these checks in place. But like I said earlier, if you're able to pay 100%, you can have all this, your benefits in full. There won't be any granulation, that there won't be any delay in benefits. Now, buying a plan is as simple as three P's. One, peruse your plan through the Andela platform, or AXA have this link already placed on Andela, your community platform. So peruse a plan that suits you based on your status. Is it single or married? Andela has already negotiated the benefits for everybody. You just have to choose one that is suitable based on your status. Are you single? Are you married? Then purchase a plan. Choose your preferred payment plan option. Do you want to choose quarterly? Do you want to choose annually, or do you want to pay biannually? Then once you have done that, then you pay with your credit or debit card. Then when you are paying with that, make sure you enable or you accept direct debit option with your card, so that your plan can automatically renew when it expire, when the period expire. And this explain that better. These are steps in buying a plan and renewal. So I've remember I said it's as simple as three P's: peruse, purchase, and pay. So then, what are the process involved in that? You go to the platform, buy a plan via AXA transactional portal, make payments with your debit card. That's the first step. Second step will be that you will enable your recurrent debits, so that the plan will automatically, the payment will be automatically deducted when the payment tenure is due and expired, so that your plan can automatically be renewed. Then, when plan expire according to your plan pay, your plan will expire according to your payment plan. If you pay for quarterly, that's 3 months. In 3 months, your plan expire. Then, because you have enabled recurrent debit, direct debit in B, then your plan will automatically renew based on the plan tenure you have chosen. And that will continue and recurring. It will go from A to D, A, B, C, D, A, B, C, D all the time. But there are times that your card may have expired, or it may fail because of payment. Maybe your card was not funded, or maybe you change your card for any reason. So it means that in any of that case, you have to go back again from A and also follow up to C, or whether you did not set up direct debits when you bought your plan in the first place. That means you have to repeat the process from A to D, process A to D. But if you have done, if everything is fine, the process A to D will keep recurrent, will keep recycling until you have any of these conditions. Maybe your card expired, or it failed to debit, or you did not set recurrent. So this is how you buy your plan. As simple as it is stated here. No ambiguity. It's not cumbersome to follow. So reaching out to AXA Mansard, so you can reach out to us if you need any inquiry, or if you want more details about your plan. This is our contact. 0700 AXA Mansard is the contact number, and you can reach us via any of this email. I can reach us through any of our social media handle at AXA Mansard. So at this juncture, I think I'll wait, and I think I want to see if anybody will have anything to ask. I'm back to you, Stan. I think I've done justice to this. Thank you.
Awesome. Ayodele, honestly, that was such a great presentation. I personally
Thank you.
learned a lot. Some of the things, like smaller things that I didn't even know existed. So this was great. Thank you so
Wow,
much.
good.
Um,
Thank you.
so we did receive, so far we actually received a few questions. Thank you guys so much for sending those. Feel free to send them as we keep going along. So there was one question. So it says, let's see. When I spoke to AXA, they said even if I pay for a year, I will have to wait for Q3 to access vaccinations for my son. So which is it exactly?
Okay. All right. So if you pay for 1 year at a go, you will ignore all the granularity. You have full access to the plan. So that was stated in the Q&A. You can see that in my presentation under the terms and condition, under the important information, important notice and information. You can see. So customer who pays annual premium will have access to the full benefit from the commencement of the policy. So you don't need to wait. So if you pay for year, it's only when you now pay flexible, choose flexible payments, then that is when all those will now apply. Hope that's clear.
Perfect. So thanks so much for that. Ayodele, so basically what I hear you saying is that the vaccination benefit is available to people that have been on a plan for it until Q3. So that means they have been on a plan for at least half a year, right? And so on the
Yes,
seventh month, they will have access to that benefit. And then are there
exactly.
any limits? Okay. And are there any limitations as far as what type of vaccination they have access to? Like, would they be able to do a COVID vaccination, for example?
Also, it's only except in a situation whereby they have. Okay, let me get it clearly so that I will mix up. Say the question again, please. Can
So
you
my
repeat the
question is
question?
about the type of vaccines people can get. Like, are there any limitations? So, like, certain vaccines are covered under the benefit, and certain
Okay,
vaccines are not. So,
all
for
right.
example, a COVID vaccine, would that be covered under the plan?
All right, it's okay. No, so first of all, our vaccination is for children from age of 0 to 5 years.
Mm-hmm.
Okay, there's no adult vaccination, but yet the children vaccination, what we give is a combination of here in Nigeria we have what they call NPI, National Program on Immunization. They have already um, um, they have already set out the immunizations that is required for children. And again, that is must have. Then we have good to have. Good to have vaccinations are those ones that, although they may not be in NPI, but they are also important for children, like like rotavirus, like pneumococca, like so many, like HIV. So those ones are also inclusive. So all the immunizations that all that HMO can cover is already available for everybody on the plan. Andela has already negotiated that for that. So what we will not cover is the immunization that HMO do not cover at all. One of them is COVID vaccination. COVID vaccination is controlled by the government, so you have to go to the government accredited center, but you can get it. But all the immunization, like I said, immunization is for children from age of 0 to 5 years.
Mm-hmm.
Immunization is not covered for adults on the HMO.
Okay, so no vaccinations will be covered for adults. So, for example, if somebody was needed a yellow fever vaccine because
Yes.
maybe
Okay.
traveling to a certain country,
So,
they would not be
so
that would.
okay, pardon me. So only in two cases that we allow to vaccination for adults. We allow a yellow fever and hepatitis B vaccination.
Okay.
But that is for even for children from zero, not adults even. It's from children from age of 6 to 18 years. I mean to
Okay,
17
got
years, 6 to 17. From
it.
18 years and above is still regarded as an adult. So, but from 6 to 17, you can have yellow fever, you can
Mm-hmm.
have hepatitis B, but
Mm-hmm.
adult does not have any vaccination. That is
Mm-hmm. Got
vaccination
it.
is not.
Got it. So if for example, if somebody has a family and they have their kids insured under like a family plan, and they buy a yearly family plan, and so on the seventh month, their children will be eligible if they're between 1 and 5, they will be eligible for all sorts of different vaccines. And if their
Yes.
children are between 7 and 6 and 17, they would also be eligible for yellow fever and hepatitis. Correct.
Yes.
Okay.
So yeah, so if you can still see my screen, yes, you can see. Just to bring it back and make it. If you can see my screen, you can see these are the vaccinations that we can all get. You can see. Um, we can see routine immunization is for 0 to age of 5 years, and additional immunization. So all these vaccinations are the vaccinations that children get in Nigeria. The one that is not here, particularly are the one that is probably is not available,
Mm-hmm.
maybe yes, or HMO would not give, like
Mm-hmm.
cervical cancer for children. HMO don't give
Mm-hmm.
that. So
Got it.
but every other ones that HMO gives and allows already. Um,
Mhm,
so and you can see from Q2 for additional immunization. But if you pay like said, so if you pay a full year premium, you don't have this is not applicable. The accessibility period is not accessible. So you have your access 100% right from when you pay if you pay a full year premium.
if if someone pays for full year cover, they will have access to this benefit right away. They don't have to wait
Yes,
until like 6 months.
exactly,
Oh,
exactly.
okay. If it only applies if people are paying on a monthly basis.
Yes, on quarterly
Yeah,
basis
the way.
or
Oh,
allocated
okay,
or
okay.
whether
Oh, got it.
yes, case
Okay,
basis.
so there is an incentive to pay for a year because you people might get access to the benefits much faster than versus if they paid on a monthly or quarterly basis, correct?
Exactly, exactly.
Okay,
Thank
got
you,
it.
sir.
Okay, cool. Okay, cool. So then, awesome. By the way, Idel, is it something you would be able to share with us after the webinar? I think that deck has a lot of really great
Yes,
information.
sure, sure. We
Would
can.
you
We
be
will
able to
share.
send it to us? Yeah, okay, cool.
Yes, we will.
And I'll
So,
make
and
sure that
again, for
everybody
your
on the
information,
webinar receives.
for your information is also available. You already is already available at the port at the platform where you can buy the plan, so you can preview. So
Mhm,
I'm just saying. So,
mhm.
so,
Okay, cool.
but we will
So
share
I know
this.
we have just a few minutes left, so let's go ahead and go through all the questions. So we had one comment coming from Latte. What kind of a plan can I use for a family of two?
Okay, so the way we've done it, so we have used the community rating system in our pricing, and the community rating system is that either you are married or single. I mean, either you are if you are married, you buy family plan. If you are single, you buy individual plan, regardless of the number you have. So so we hope that if you don't have if you don't have children now, we are hoping that you may have children at any time.
Mhm,
So when you have them, you don't need to add pay for them. You have already prepaid for them because you have already bought family plan.
mhm,
So if you are married, you buy family plan. It's only if you are single that you buy individual plan. So and we use community rating pricing for Andela. So
mhm.
that is why you
Yeah,
see family plan is cheap, especially for those who have a large number of family.
yeah. Okay, perfect. So a family plan costs, how much does it cost a month versus what?
480,000 naira per annum and 120,000 naira per quarter and 40,000 naira per month.
Okay,
40,000 naira per
40,000.
month.
Okay. Yeah. So it's yeah. So those are the premium line sorry,
Somebody
numbers.
asked me if I should go back to the pricing slide. Okay, good. I can quickly go back there.
Yeah.
Okay, all right. I think you can see this.
Hmm. Yeah. So you guys can see that on the so the top one you see is actually for a family, and the
Yes,
bottom one is for the individual cover. So you
in the
see that
individual,
for a
yes.
family
So
on a monthly
the one
basis.
on top, yes, exactly. So,
Mhm,
so the first one is monthly. The second, from the left to right. So the first one is monthly.
mhm,
The second one is peach color is for quarterly and per annual and annually. So you can
mhm.
see that.
Mhm. Cool. And also, you guys, I sent a link in the chat earlier. It's a link to the Help Center article about the Nigerian plans. That article also has the outline of the premiums too. So we will be setting the deck after the call today, but we'll be setting the deck after the call. I'm not sure if it's going to be today, but in the
All right.
meantime, you do have access to that health insurance article as well to use as a reference. All right. So then the next question we got was from Lapang, from Mark. What if instance
Well,
where
one have to
one
move from individual to family. Okay.
family
What we
plan?
do is if you had pay a full year and you need to move, what you do, you are going to buy a new plan. So when you buy a new plan, so we would terminate your existing plan. Let me
Mhm,
still it again. You have already bought a plan for 1 year as an individual. Now you want to migrate. At the time you want to migrate to family, you are going to buy a new plan as a family. We will stop your existing plan. I will prorate for you
mhm,
based on how many months you have used, and we can
mhm.
make a process a refund to you
Uh,
for the one we
okay.
stopped.
Yeah.
Okay,
So
then
as
you
an
can go.
example, yeah, as an
Okay, go
example,
ahead.
if they bought like a yearly plan, let's say they've used 6 months of that, and then they
Yes,
realize they would like to get a family plan, you would guys
yes.
then stop the individual plan. You will refund them for the left
For the
over
six
six
exactly.
months, and then they will
Yes,
start the new family plan. Okay.
exactly.
Okay. Cool. Mark, let us know if that was clear. And then the last question was from Latte as well. Can you pay for HMO for a child alone, individual plan that is? I
No,
think it's a
no.
no. Yeah.
So because it's a minor, you can't buy for a minor because it's a
Yeah.
minor. That should be need to be someone to support. So
Mhm.
only child cannot be on the plan. Thank you.
Yeah, perfect. Wonderful. So I had a question that has come up in the past. I don't see it's been raised today, but I just wanted to see what you have to say, Adele. What is the benefit for mental health appointments? Maybe to see a therapist or a specialist for mental health. Are there limits? Like, how soon is that available to people?
Okay, all right. So now, so first of all, when you're asking about how soon, allow me to quickly go
Hmm.
um to the benefit again, so that I will stay there, so that I can be. So now, mental health benefit is regarded there as the EAP, so employee assisted program. Okay, and you can see. So if you are paying granularly, you have to have access to until the fourth quarter. But if you pay annually, so you have access to them immediately. So what they
Hmm.
do basically is it covers you for counseling. One, it covers for baseline assessment. Baseline assessment is they send you a link whereby you fill some questionnaire, and from the questionnaire they can deduce what
Hmm.
problem or probably must have happened to you. Oh, Ayodele, you are slightly depressed based on your questionnaire.
Hmm.
Then they can tell you, okay, just make sure you take enough rest. So, but if I would need to see I need a consultation to see for a therapy session or for psychotherapy session, they will call me. I'm entitled to two psychotherapy sessions in a year under a policy.
Hmm.
So then I'm entitled to counseling, baseline assessment. I'm up to two psychotherapy sessions in a year.
Up to two a
Unlimited.
year.
So that is the session, but
Mhm.
I have unlimited access to baseline assessment at any
Mm,
time.
okay.
But
And
but
what
all the time.
exactly?
Okay,
Mhm.
go
Yeah,
ahead.
and
What exactly?
what exactly are we looking at here? Service description. Which one applies to mental health?
EAP, Employee Assisted Program, EAP.
Ah, that one. Okay, cool. Mhm.
Yes.
Cool, great. Okay, awesome. So let's go ahead. So I do have a one more exciting announcement for you guys before I let you go today. But in the meantime, let's go ahead and run the poll to see how many of you are actually interested in moving forward with getting a plan through AXA. So that's super simple, yes or no. And while you guys are filling this out, I would like to make an announcement that as you know, a Black Friday is coming. So Black Friday is actually, I think at this point, is a very sort of international, a quote unquote holiday, right? And so I'm super excited that Ayodel and his team were able to come up with an awesome promo for us. So essentially, AXA is offering two gift vouchers for 50,000 naira to every so they offering a chance to win a gift voucher for 50,000 naira to everyone who purchases, renews, or extends their plan between now and November 25th. So if you are serious about getting a health insurance plan, you've been looking for a while, and you're happy with the terms and everything that Ayodela mentioned and touched on today, I think it's a great chance for you not only get the health insurance plan, but also win a gift voucher as well. So some of the conditions there, you will have to again purchase when you extend your plan between now and November 25th. You will have to buy a plan for at least 6 months, right? So it's not a year, it's not a month, it's not 3 months. It's at least a 6 month subscription. And then on November 28th, so you will, once you do that, you will automatically enter into a raffle draw. And on November 28th, we will announce and reward the two lucky winners. So there are only two vouchers that are available. So if it's something you would like to participate in, make sure to go ahead and take advantage of this amazing offer. Ayodele, did I mention everything? Did I forget anything about the promo?
Exactly. You perfect.
Okay, awesome, great. Amazing. So we're right on time. I thank you so much, you guys, for coming to the webinar, learning about the new the terms and the conditions and the plans. It was great to have you all today. I really appreciate all the thoughtful questions that came in as well. If you are looking to go ahead and get a plan, I'm just sending a link here, which is basically a web page where you can submit a request for health insurance plan, and then your information will be sent into AXA, and then they will reach back out with the next steps as well. If you have anything, any other questions, you can find me on Slack. My name is Stanislav, and it's the easiest way to reach out to me as well. Again, thank you so much, Adele. Thank you so much for the amazing presentation. Oscar, thank you so much for the back end work
Okay,
there.
bro.
And I'll talk to you guys soon. Happy Tuesday.
All right. Thank you. Bye, everyone. Thank you, Stan, and thank you, Oscar. Bye.